Hello and welcome. My name is Brandon Smith. I'm a licensed professional clinical counselor in the state of Minnesota. Is your mental health interfering with your life, getting in the way of things that you want to be doing? Well, I'm going to talk today about how you can do the stuff you previously thought you couldn't do. The concepts we're going to be covering today are behavioral activation, opposite action, radical acceptance, and willingness. These are a variety of skills between CBT and DBT. Both are very aligned and very similar, but they're unique in different ways. So many of my clients tell me that they can't do something, that they can't get out of bed, that they can't do the thing that they've really wanted to be doing. And honestly, if you have that thought, that's the thought that's going to get in the way. So what I'm going to talk about today is going to help you jumpstart and do the things you want to do. The caveat is it's probably going to be pretty painful in the beginning. The fact that a client rolled out of bed and came into my office proves how much they can do when their mind is set to it. Even if you're not going to therapy, the fact that you can get out of bed and go to the bathroom proves that your body can carry your own body weight. The way that I bring it up to my clients is I say, it's not physics stopping you. There's nothing physically that gets in the way of you doing the things you want to do, unless they're truly unreasonable, like lifting 500 pounds if you've never done it before. But even in that case, we can build ourselves up to it. That alludes to one of the concepts that we call shaping, which is starting from a small standpoint, little steps along the way, as opposed to trying to achieve a goal in its entirety. The problem with not wanting to do meaningful activities in your life really has very little to do with what you can or can't do. It has so much to do with motivation. And motivation is basically something that reduces the painful nature of doing something. So if we don't have motivation, usually the thing we're going to do is a bit emotionally painful. Depending on what we're talking about, even working out could be physically painful to do. The thing to remember is at first, it's more painful. But through the lens of behavioral activation from CBT, the idea behind it is the more you start doing something, the less painful it becomes over time. And especially if it's something that's meaningful to you, you care about, you want to do on your own, that's something you're going to build motivation to do as long as you just get started. Now, I really don't want to sound callous or cold and pretend like it's an easy thing to do. I'm not saying that people are just lazy and don't want to do things. That isn't the point of this video at all. What I'm trying to get at is that if you really want to do something, it might be very painful and a lot to ask, but if it's important, it can improve your mental health so much. An analogy is a lot of people like to do ice baths. And ice baths are extremely painful for most people. I don't know if there are any actual benefits to it, but if the benefits that they suggest are real, well, then it makes sense why people do a painful thing like getting into an ice bath. If we take the analogy back ever so slightly and we just talk about getting into something like a cold lake or a cold pool, that's something that a lot of people hesitate doing, is a bit painful, but not nearly as painful as an ice bath, but we still don't always have motivation to do something like that. I remember being a kid and wanting to jump into a cold lake or a cold pool, and I hesitate significantly. I'm sitting there standing on the edge, about to jump in, but then I don't. And I wait, and I may repeat this several times. But often there's a point at which something just clicks and I'm willing to do it. That's the skill of willingness. Willingness is a form of radical acceptance that's pushed towards doing something that's effective for you. And so when you get willingness, there's this not so much motivation that drives you to do something, but rather just a loosening of the restriction that was preventing you from doing something. It's basically an acceptance of the pain you're about to do and just doing it. And often the pain that's stopping you from doing something is an emotional pain. So the skill that we get involved with that is called opposite action. When you've decided that an emotion and or its urges are not effective for you, then that's something that you may want to do the opposite of. And it's really hard and it can be very painful to do so. But the benefit of opposite action is the more you react in the way that you want to, again, the less painful it's going to be, and the more likely you are to do it in the future and build those neural pathways that make it easier, and maybe even more enjoyable and less painful. Okay, so I've talked about a few concepts that are about jumping in and just getting started. Just talking about this and understanding the concept and even just getting the idea that like, oh, I guess I probably can do this thing that I've been avoiding doesn't necessarily mean it's just going to click and you're going to do it. These are skills that take time to build, and I don't want to pretend like it's easy to do so. Honestly, where I'd like you to start is not even with the big goal that you're working on to begin with, but just small things along the way. I like to call it the just because exercise. Do something small that is meaningless, doesn't provide you any benefit, but just proves you're in control. Basically, you're telling yourself and you're showing yourself, I can do something if I just decide to do it. Start with something small, start with something easy, make a small mess and just clean it up. Next time, make a bigger mess. Clean that up. Next time, brush your teeth when you don't need to brush your teeth. Do something you wouldn't normally feel motivated to do, then work your way into the things you actually want to be doing, whatever it may be. I'll start with an example I've heard from several clients before, and that is brushing their teeth. When a client wakes up and is moving around and doesn't feel like brushing their teeth, but they realize that's something that they should probably do, the skill that I have them try is I tell them to stop, freeze. Don't move a muscle, don't walk any further, don't do anything else until you feel that willingness inside of you that says, the next thing I'm going to do is go brush my teeth. Don't be looking for motivation. Don't be looking for the desire to do it. Just look for the willingness to do it. Chances are it isn't something just as simple as brushing your teeth that you're avoiding. Chances are you might be avoiding a lot of things and even bigger things than that. So just get started doing the smallest of the things and just add a little bit over time. Every week, try to do just a little bit more, but not that much more so that it becomes overwhelming. Most importantly, really look for the positive effects on the other end of having done the thing. If you're not mindful of the things that you're doing and how it's benefiting you, chances are your brain's only going to focus on the negative, and that's where it's going to try to not do it again in the future. To be honest, I'm not a big fan of brushing my teeth either. It is a challenge for me on some days, especially the weekend when I don't have obligations, but I find myself just clicking, deciding I'm going to do it. The experience of it is not all that painful, but not something I want to be doing. But I feel so much better after I'm done doing it. My mouth feels cleaner and I feel ready for the day. For some reason, it just gets me going. Look for that kind of a thing. Sit and experience it and use that to benefit you and potentially build actual motivation to do it on the other end. Motivation is not the enemy. It's just not something we can always cultivate until we've done the thing that we've been avoiding for so long. A lot of people are really looking for the motivation to do it beforehand, but you may not build motivation until you do it and do it several times. So the core essence of what I've been talking about today is chances are you can do the things that you've been avoiding. You can do the things you thought you couldn't do. Again, the thought itself is probably what's stopping you most of the time. But if you can actually physically do the thing that you want to do, start small, build it up, do it even though it's painful. And over time, it'll loosen up. It'll feel easier. Look for those positive aspects of what you're doing that are beneficial. And then you'll start to build motivation to do what you want to do. Think of things like a muscle. The more you work it out, the stronger it'll become, and the more you'll be able to do in the future. Just keep going little by little by little. Thank you so much for watching this video today. I just made a recent video before that was when therapy doesn't work. So if you want to watch that, be sure to click over here, leave a like, subscribe if you're really enjoying the channel. I'm just starting out. I'm trying to make more as I go along. And the more subscribers and the more people that I get that are interested in this, the more videos I think I'm going to make on a regular basis. I hope you're doing all together all right.